Well, hi, welcome to February's Aging Well. We're so glad you're here. You know, February, we think of hearts and love, and we have a presentation tonight on heart health. But, you know, I was thinking today, there's so many things just every day that I love, you know, and I try to practice gratitude a lot. And I just was walking in my neighborhood thinking, I love the feeling that spring is just around the corner. So I hope if you were outside today, you kind of had that same feeling. Anyway, welcome to Aging Well. And first and foremost, I always have to thank the team. So thank you, Tom Roth with our CTSI, Audrey Bell Farrow with our aging program, and Courtney Hayes with our aging program. We're so grateful that all of you are here because, again, if you weren't here, we wouldn't have anything to do on a Tuesday. But we want to get right to it because we have got a jam-packed program for you tonight. And I'm so excited. We're really focusing on downtown Winston-Salem. From those of you who aren't from here, I'm very sorry if you're not from Winston because we're a happening place. And there is a new IT restaurant right downtown called O Calcutta, and the Tanduri chef, Gabriel, and then the restaurant co-owner, hang on, I always want to make sure I pronounce it correctly, Paul. I'm not even going to try to pronounce his last name because I know I would slaughter it, are going to show us how to make Tanduri Paneer. So without further ado, I'm going to turn it over to them. Oh, and we have a secret bonus that Nicole Harvey is going to show us how to make one of their signature cocktails.
Welcome to AgingWell. Thanks, Deb. My name is Gopal Chandarana, one of the co-owners of O Calcutta. We're going to show you how to make Tanduri Paneer. And this is my tandoor chef, whose name is Gabriel. He speaks broken English. That's the reason I'm translating how to make it. So he's going to start over here how to make a Tanduri Paneer in our big oven tandoor, which I'm going to show you in a few minutes. So this is the potato just to guide, not to fall later when we put the tandoor paneer in the tandoor. It will not fall. That's a guidance. There's a red pepper, green pepper. Then we put paneer, which is cottage cheese. And then again followed by the same thing. We do it over and over for 5 times. And then later on, I'm going to give a recipe to Deborah, which she can share to the Aging Well. So now we cover again top with the potato. So when you put in the tandoor, it will not fall. He'll show you how he's going to do it in the tandoor. Right, the tandoor is right there. Go ahead, you go ahead. So tandoor is a clay oven. It is about 400 some degrees Fahrenheit over there. It's very hot, and the paneer is cooked inside. It'll take about a few minutes. Once it rolls up, then I'll show you how we garnish. And it's a very easy dish which you can cook at home even if you don't have a tandoor. I will show you. Probably you just do the same marination in a bowl like this. You can put all the ingredients over here, toss it around, and then you can do a non-stick, non-pan fry also. You can. So at home, if you have a non-stick pan, then you can warm this one, put some little bit oil, and in a very heat one, then put this cottage cheese, which we call tandoori paneer, onions all mixed together, and then we're going to cook it for a few minutes. You can tell probably it take about 2 to 3 minutes to cook in the non-stick. He has to turn over here because the oven is like from the bottom is one side heat you get. That's why he has. But in a non-stick pan, you just toss. It's like a scramble like this. Tandoori is the ingredients which put as a, I can name it. What is? Oh yeah, they need a tandoori masala ingredient. So I'll give it to you. That also the what is actually put in the masala. So I'm going to show you a tandoori paneer. The ingredients which I have it on the bottom over here on the plate. I'll show you how to make it at home if you want to do it. It's very easy. You can go to any Indian grocery store you can find. This is a yogurt, plain yogurt, and this is a turmeric which you put a little bit, and then you have garam masala which is you can get in the Indian store. This is a red chili powder, and this is salt as you taste, and garlic ginger paste over here. So what you do is, and then you have to have a little bit of mustard oil also. If you don't have mustard oil, we can put butter too, right? So I put this one like that one, everything. I can mix it with the hand, or if you if you want to use the spoon, I'll do it with the hand because I have a glove. So you do all mixed together like this one. So see how the color is coming, you can tell. And then what you do later on, just mix the paneer, which you have it over here. And then you have some green peppers, red peppers, and onions. I will take from here, just cut it over here and just mix it up together like this. So once you do this one, let it marinate for at least 15-20 minutes in the refrigerator. You can do that. You don't want to cook right away because it will soak all the masalas in the peppers and onion and cheese. Once you do it, put in the refrigerator, and then if you don't have, nobody will have a tandoori at home. So you can put in a non-stick pan, just medium heat, put some oil, or you can put a butter too, and on that, just put this like you store it away. When it cooks in few minutes, you can see. Then once we come out, because it got dried up, you're recording? Once it comes, it dries up, so you put a little bit of butter to get it glazed. That's it. Hmm? Cooking a little bit more. So what we are doing right now, we're just cooking a little bit more from the top. If you put in the direct oven, it gets burned. But if some people want crispy, then you can put longer inside. But we're not doing that. We're not making burn this way. Take it up. Dikhane ke. So now we're going to garnish over here. This is how we present in Calcutta. It's really, really hard. You got to be careful. Songchi. Hmm? So this is how the whole complete of the tandoori paneer like that one. You can look at it, and then you can sprinkle a little bit to make it look low appetite. You can put some little of a cilantro. We do that. See there, we can put a little bit of cilantro to make it look more appetite. And then if you want more little bit spicy, we have chaat masala, which I will share the ingredients with Deborah. Let me have a chaat masala. This is chaat masala. You can sprinkle like this one a little bit. And ready to eat. That's it. And then this is how it's ready to eat. Come see us at Calcutta, and we're going to share the ingredients, everything to Deborah.
Hi Deb, thanks for joining us from AgingWell to Calcutta. We're going to be making a revitalizer today. So you're going to start by muddling cucumber. You just want to take about 3 chunks. Put in your cup. You're going to muddle that down. You're going to put a dash of bitters. I'm going to put some of the Hendrick's gin in there. And your Saint Germain elderflower. And don't worry about the measurements. You can get that off of Deb's site. She'll be sending the recipe. Then you're going to put some ice in there. Just shake that up. All right. You get your strainer, pour it in the glass. Then you're going to top it with tonic. And then a cucumber for garnish. And that's about it. Thank you for joining us. And you can check out the full recipe on Aging Well with Deb.
You know, I'm not exactly the most brave of all cooks. I don't know that I would try that at home, but I will tell you, I've had it at the restaurant and it is delicious. So if you're feeling adventurous, you can try it. If not, it's such a fun restaurant. So you may just want to try it after you visit Callidium downtown. Once again, it's a feature of downtown Winston. And those of us who live here and kind of circulate around town have been watching this cool building coming up. And, you know, for the longest time, it was Callidium. And you think about it, all the artwork, it's a kaleidoscope. So that's where the whole name and the design of the building have come from. And it was just such a treat to get to do a preview. And because I got to do a preview, you're getting to see the preview. But one thing that they stress, it's not just for children, and it's not just for us grandparents taking our grandchildren. They are having fun events just for adults. So sit back and enjoy, and we're getting to have a sneak peek of the new Callidium building.
Hi, Deb. Thanks for coming out today. We're so excited to have Aging Well at the new Callidium today. We have our very first trial field trip here today, so we might see some kids in here, but come on in and let me show you the place. So here at Callidium, we're a merger of the Children's Museum of Winston-Salem, which was a children's museum, and SciWorks, which is the science center. And we have created something that is more than just a children's museum meets a science museum. We call ourselves an experiential learning museum. And at this point, there's so many places you can get content, right, on the internet and through books and the library, but we feel like what our community is really needing is a place where people can practice hands-on learning to develop skills. And those skills can be a broad range of things, from foundational skills such as literacy, but all the way up to frustration tolerance and perspective shifting and making a new friend. As well as all sorts of STEM, science, technology, engineering, and math opportunities, and all sorts of art and creativity opportunities as well. So I hope as we tour the rest of the museum that you will see legacy elements from the Children's Museum that people have loved, from SciWorks that people have loved, as well as opportunities to create, art to appreciate from local artists, as well as lots of opportunities to innovate and iterate and practice science, technology, engineering skills as well. As a merged experiential learning museum, sometimes people really think of us as just a children's museum, but we really are so much more than that. We have been very intentional to design for all ages here. So we actually have, for the exhibits, an Excel spreadsheet where we've really listed babies to toddlers to young elementary schools, all the way through 3 or 4 different kinds of adults, meaning adults who are caregivers. So if you're here as a parent or a grandparent, that's one role, but also just adults for adults' sake. Adults also need to play and learn and experience just for their own sake, not because they're a caregiver. And so we also really look in every gallery to see, is there something that would be engaging here for an adult who's a novice to this content, as well as is there something that would be engaging if you're an expert adult in this content. So here we are on the first floor in the By Design Gallery. This is the only exhibit gallery on the first floor. This gallery is a mashup of Winston-Salem, Forsyth County meets design professions. So you'll notice in here the custom wallpaper that showcases murals and architecture and logos that are unique to our community. You'll also see components where you can use magnets to color in a mural that was designed by local artist Kel Mayo. We have places where you can code choreography and create this little dance-off between these two avatars here. There's a place where you can build a furniture prototype. There are blocks where you can build buildings. There is also this light table here where you can create your own custom logo. And lastly, we have a tattoo and body art and henna design station where you can design a piece of art that can project onto your own hand. Here on the second floor at Callidium, we have our In Motion gallery. This gallery in here, you will notice, is very reminiscent of PhysicsWorks in Cyworks here. So you have places where you can play with a Bernoulli blower, where you can play with gears on the wall, experiment with electricity. You'll see the Airways exhibit that came from the Children's Museum of Winston-Salem. And we have this fantastic roller coaster ball wall here where visitors can crank using a conveyor belt the balls up. And this is reminiscent of the Children's Museum donut factory that our community really loved. And people can create pathways that go onto the floor. I think this is a great example here of the scaffolding that we tried to do with each exhibit. You can see here that a very young toddler could just put a ball on the roller coaster that's on the floor there, all the way up to all ages. You know, kids in elementary school are really going to enjoy cranking the balls up the conveyor belt. But myself, even as an engineering degree, has spent hours in here crafting my own route where the ball comes off the wall and actually transfers onto the units on the floor. So really our hope is that we've done this in every gallery where there's really something for everybody in here, people of all ages, people of all interests. We have our feature exhibit gallery on this floor as well. We hear from visitors quite a lot that they want change. Exhibits are very expensive, so what museums do is we rent exhibits from each other and we ship them to each other. Callidium also owns 2 or 3 of our own that we bring back regularly. So what we have here right now is Framed Step into Art, and this is an exhibit that the Children's Museum of Minnesota created that features artists. So the last thing we have on the second floor here is our digital dome. Our digital dome is our upgraded planetarium. We heard very loud and clear from our community that they wanted the planetarium to come to the new Callidium, so we've brought that, but at this point the technology is so advanced that with a digital system you don't just study the planet. So we are training ourselves not to call it the planetarium anymore. We're training ourselves to call it the digital dome, because you can study plate tectonics in here, the human body. We can watch movies in here about the sea, and so this is our digital dome. And you can see here on the outside of the digital dome is more custom wallpaper. You can see more images that are reminiscent of Winston-Salem, and Wake Chapel is here, you can see. So moving on to the third floor, we have 3 galleries here on the third floor. We have Our Nature, where we bring the animals that we had at Cyworks inside. We have Huey the parrot, which was a favorite. We have a place here where you can sketch, and it's non-consumable. We're trying to be as gentle on the environment as we can, but at the same time, it's a very common tool that biologists use. If you think all the way back to Audubon, sketching. And so there's a lot of good learning that happens from sketching. So again, we're just trying to introduce all sorts of opportunities here for people to do things that they might not take the time to do or have the opportunity to do. And again, we're very, very excited to evaluate and see how this works. And we're really hoping that we can encourage grown-ups to come without kids and take that opportunity to come play and do these things. On this floor, we also have a storytelling gallery. Science is really clear. We have evolved to learn through storytelling. It really works. And so we knew from the beginning we wanted to do an exhibit about storytelling. So at this announcing throne here, we've done that. You pick 3 different descriptors and you're creating a character, and then you sit down on the throne and it announces your character. We also have places where you can do shadow puppets and a stage where you can do lighting and costume design. You can dress up in costumes and you can light the stage. Notice there's a ramp here. We're trying to be very conscientious throughout the design here that this really works for people of all abilities as well. So our font size and our contrast on our signs, we're trying to be very mindful of. We worked with the Mayor's Council for Persons with Disabilities to make sure we're wheelchair accessible, and that we're really working for people with disabilities as well. Particularly as we age, more and more of us will have some difficulties with seeing or moving or hearing, and so we're trying to be very thoughtful about that with our design as well. Our third gallery here on the third floor is the Wonders of Water. And so I talked a little bit about how we talked to over 100 people at the Children's Museum and over 100 people at the Science Center and over 200 people just in our community. But what we also did was we visited museums literally all over the world. And at every one of those museums, we were interviewing 50 of their visitors and their members to say, hey, we're building a new museum like this in Winston-Salem, North Carolina. What do you think is the coolest thing here that we should have? And if that museum had a water exhibit, it was listed time and time again. You'll notice we feature all 3 phases of water here. So we have this large ice block here that you can use these stamps, and the heat of your hand transfers through this metal stamp to make the pattern in the ice. You can see that over here there's a fog tunnel where you can see water in its vapor form, and you can experiment with shining light through the vapor. You can really look at how the air moves because it really visualizes the air for you. We have art in here as well. We have this really cool piece here that was designed by a UNCSA grad student. There's this digital aquarium here where you can design your own water creature and then send him or her onto the digital aquarium here and see your piece designed swimming throughout here. And then of course there are the water tables themselves where you're experimenting with diverting water and building dams and these great vortexes and vortices that people just really love the experience of getting their hands wet and doing this hands-on learning. On the 4th floor we have the Little Learners Gallery. And this gallery, again, is what we call thoughtful exception. Most of the galleries all of the galleries are really hopefully designed to work for everybody, but we do know that our littlest, tiniest members who are just learning how to crawl or walk often need their own place, particularly when we have lots of people here. So that's what the Little Learners is for. And so in this exhibit, we really try to feature the caregivers as well as the babies. And so the things for the young children are all very down low and they're soft and they're all within reach. But then we also have these movable seats with ottomans so that you can sit down and take a rest because it is hard work to watch out for those little kids. So this is for parents and grandparents and anyone who's looking after a young child. And then we have the Try It Studio. So the Try It Studio is run by our education department. They will work with people in the community who maybe want to come teach other community members how to watercolor, as well as our own staff might help you program a robot or lead a yoga class. So there will be a huge range of things that are happening in the Try It Studio, and that will change on a daily basis. The things I'm most excited about is our rooftop playground, which you can see from the ground level outside. We will not be ready to open that until the summer of 2024, but when it is open, it will be really on 2 levels. We have a large bridge there that we've made wheelchair accessible so that, again, people with mobility issues can really experience this pinnacle opportunity of the museum. We really want to be very inclusive and make sure that everybody gets to do everything that they can at Caladium. We will generally be open from 9 to 5, Tuesday through Friday, 10 to 5 on Saturday and Sunday. Mondays, we reserve the mornings for members only to have a quieter experience, a more personalized experience. That'll be from 9 to 12. But in addition to that, on the first Fridays of the month, we will be open from 5 to 8. And on the second Saturdays of the month, we will open from 6 to 9 for an adults-only event. We're very excited. We have our own, we worked with Radar Brewery to create our own canned beer. It has a gorgeous, gorgeous label. We'll serve cocktails, and we will do some science cafes where we will bring in researchers and scientists, hopefully from Wake Forest, to talk about the research that they're doing and share that with the community. We'll have special events in the Digital Dome that will appeal even more to adults. But again, I really want to be clear that we are very much hoping that the community understands that we are for adults all of the time. And we talk a lot about how we rightly so love our kids so much, but we need to love our grown-ups and our elders as well. We're important for all of our lives. And so we've really tried very, very hard to have something for everybody at all ages and hope that everybody feels welcome to come visit us at Caladium. We're so excited for our grand opening, which our ribbon cutting is just in a few days on February 15th, and our grand opening to the public is on Saturday, February 17th. You can find more information about our hours and how to get tickets or become a member about this special events on our website, and Deb will be sending out more information to you all as well. In addition, I wanted to mention how much we love our volunteers and how much we need our volunteers. So if any of your viewers would love to be a volunteer, we would love, love, love anybody who wants to come volunteer with us. We have a whole host of opportunities, from working with kids or helping with animals, or if you're more of an introvert, cutting paper for our crafts that we're doing with our summer campers, or almost anything that you like to do, we probably could use your help. So again, you can find that information on our website, and Deb will send out a link about that as well. So thank you for coming out for a quick tour of the museum today. Of course, I just couldn't show you everything in a quick tour, so I really hope that this will encourage your viewers to come out and see us for themselves. There's so much more to see than I could show you today.
It really is every bit as cool on the inside as it is on the outside. And I just want to give a shout out in gratitude to Tracy Connor, who was our tour guide. She is the Vice President of Exhibits, as well as Leanne Woodruff, who is Vice President of Communications and Operations, and Catherine Kale, who is the Marketing Manager. They just rolled out the red carpet for AgingWell, and I'm so grateful. But I hope everyone sees that I'm looking forward to going. And, you know, anyone who knows me knows that I'm pretty much a goofball any chance I get. So I'm looking forward to being able to just play and have fun and do so many of those exhibits that are really finger friendly. They want you to get involved and experience. And the parrot they have, I did not get to meet him. He had not moved into his new digs yet, but I'm looking forward to meeting him and some of the other live animals. So again, come join me. Let's go play and have some fun, because you know what? Having fun, being active, being social, it's not just good for our brain, it's good for our heart. And so didn't you like that little segue? And so we have invited Courtney Reed. She is a PA with the Atrium Health Wake Forest Baptist Cardiology and Preventive Cardiology Department. And she is going to share with us insights on how we can keep our hearts healthy. And one thing I asked her to talk about in particular with us tonight is the difference in the symptoms of a heart attack between men and women. And this is something that I just had never heard enough about. And I want AgingWell to know the differences, so that, God forbid, if any of us ever do have those symptoms, we'll know what it is, because it's quite different with a woman than it is from a man. So, Courtney, I am going to turn the floor over to you, and I look forward to hearing your presentation.
Okay. So I'm going to introduce myself. Hi. Hopefully y'all can see me and hear me. Again, my name is Courtney Reed, physician assistant at Atrium Health Wake Forest Baptist. Been there for about 4 years now. I've been a physician assistant since 2010, graduated from the Wake Forest School of Medicine. I worked in geriatrics for the first couple years, and then I did gastroenterology here in town for 7 years, and now cardiology. So some of you may know me through one of those clinics, but I'm happy to be here. I'm happy to be invited, and happy to talk with y'all about heart disease. Since it is, Heart Prevention Month, wanted to wear red, and I'm hopefully going to be able to share my slides with y'all. So I'm going to give that a go now. Give me a second to get this set up. Oops. Okay. Hopefully y'all can see this and there's not any weird bars blocking my screen. I'm not used to giving presentations on the computer. I'm used to seeing people in clinic. So this is very new to me. So bear with me if there are any technical difficulties. All right, we'll get right started. So, when Deb asked me to talk about heart disease, I thought, well, gosh, there's so much of the heart to talk about. But I think most people want to know about heart attack prevention. They want to know about coronary artery disease. When I think of coronary artery disease, I think about the plumbing. So the heart is a very important organ. The plumbing of the heart is the part that causes heart attacks. So the plumbing that you're looking at on the screen, the red are the arteries. The blue is the veins. So the arteries is where plaque develops, and that is where heart attacks form. So I wanted y'all to see a picture of it. You know, when you think about other types of heart disease, you may think of electrical problems. So things with rhythm disturbances like atrial fibrillation, needing a pacemaker or a defibrillator. That's going to be a talk for another day. You may also think about structural problems, things like heart failure or valve disease. That is, again, a talk for another day. Today, we're talking about the plumbing. So what is coronary artery disease? It sounds like such a fancy term, but what it is the buildup of plaque in the arteries that supply blood to the heart. So when we talk about plaque, I am talking about cholesterol buildup. And some people get a kind of mistake in their mind that you have to have high cholesterol to have cholesterol buildup in your arteries, and that is not true. We see people with heart attacks who have completely normal cholesterol levels. So cholesterol can build up even if you have normal cholesterol levels. There are certain things that increase the risk, and we'll talk about that in a minute. But I wanted y'all to look at this picture. So what you're looking at is a zoomed in view of this coronary artery. This is called the left anterior descending. So I'm trying to highlight that with my cursor. That is the widowmaker, as everyone knows it. So the zoomed in picture over to the right-hand side, the top picture is a picture of a normal coronary artery. That's what you want your arteries to look like. You want blood to be able to flow freely and there to be no obstruction. Now, this middle picture is a picture of some mild coronary artery disease. So there you can see there's this mild amount of kind of yellowish, whitish buildup. You can think of that as like, you know, you think about the pipes in your house. You're not supposed to pour oil and grease down the pipes because it's going to build up in the pipes. So think of that as the heart as well. So we'll talk about diet later as well. But that's what it starts to look like. Now the blood is still flowing through there. So this person may not have any symptoms at all. They may not know they have coronary artery disease. Typically, as the plaque progresses, as it gets more and more thick, it becomes more obstructive, and it does start to block the flow of blood. And that's the bottom slide here. So it's mostly plaque and very little blood flow. And those are the people who are going to have what's called angina or angina. Those are the people who might pop a nitroglycerin tablet under their tongue when they're walking up a flight of stairs or they're taking a walk around the block. So we want to prevent this plaque from forming. And if you have plaque, we want to talk about how can we stabilize it and how do we prevent that from causing a heart attack. So coronary artery disease is the #1 cause of death in the United States as well as worldwide. Interesting fact is that most people with diabetes die from heart disease and not from diabetes. And despite the fact that there's so much coronary artery disease in the world, in the United States, there is no recommendation for screening. So we don't do any sort of routine screening like we do for, let's say, colon cancer or breast cancer. So it's interesting dichotomy, and hopefully that's something that will change in the years to come. But at this time, there is not screening. So coronary artery disease is typically multifaceted as far as what causes it. So as I mentioned, you know, one of the risk factors is high cholesterol, but not everybody with heart disease has high cholesterol. It is a risk factor, and if you have high cholesterol, it is very important that you control it with diet and exercise and potentially medications. Diabetes is a big risk factor for heart disease. If you have diabetes, the lower you keep your blood sugar, the better off you're going to be. If you have high blood pressure, it's important that you treat that again with diet, exercise, weight management, blood pressure medications. If you're a tobacco smoker, you've got to stop smoking. Smoking is a huge risk factor for the buildup of plaque in the arteries. Obesity is a risk factor. Those are things you can control. So the things on the left-hand side of the screen are things you can control. The things on the right-hand side of the screen, things you can't control. Age is a big risk factor. So the older we get, the more likely it is we're going to have plaque, just like our pipes in our house. The longer those pipes are here, the more issues they're going to develop. If there's a family history of coronary artery disease, so if your father or your mother had a heart attack, had a heart attack at a young age, that's something that you can't change, but that risk is there, and that may increase your risk. Being a man is a risk factor for coronary artery disease. Men have heart attacks more than women until menopause. So women, after menopause, the risks start to increase. So our female hormones are actually quite protective. And after menopause, we no longer have those protective hormones, and our risks start to increase, and we start to equal the risk of men. The other risk factors that aren't listed on this slide that I think are important to highlight are chronic inflammatory conditions. So things like lupus, rheumatoid arthritis, Crohn's disease, ulcerative colitis, HIV/AIDS, end-stage renal disease, so people on dialysis. Those are chronic inflammatory conditions. Inflammation, we think, is a huge risk factor for the buildup of plaque in the arteries. So controlling those underlying inflammatory conditions is very important for prevention. I should say Deb is going to keep track of questions. So as we go along, if you have questions, feel free to submit those, and then we'll get to those at the end. So everyone, I think, is interested in what are the symptoms of a heart attack? What are things you should look for, be concerned about? When should I call 911? And I know Deb wanted to make sure I talked about the differences between men and women, how they present differently. So again, I work in not only general cardiology, but preventive cardiology. So I see a lot of people after their heart attack or after their bypass or after their stent's been put in. So I definitely talk to these people on a daily basis, and I hear from them what their symptoms were. The most common symptoms you're going to have would be on the left side, and it's not typically one spot. So it's not usually, I had a sharp pain here, it went away after 5 minutes. It's not that. It's usually a generalized left-sided discomfort, pressure, tightness. Some people say it feels like heartburn, but it didn't go away with my typical heartburn medicine. It may radiate down the left arm. It may radiate up into the left neck or the jaw. It is often associated with a feeling of shortness of breath. Some people, and as they comment here, women, you may feel nauseous, you may actually vomit, could be lightheaded, you could faint, or just have this significant fatigue that washes over you. But it's typically going to be pretty significant. So most people know something is wrong. A lot of people want to put it off and think, this is going to get better, I'm going to give this some time. But if you have any of these symptoms that come on suddenly, whether they wake you from sleep, they could happen at rest, they could happen with activity. But if you have something that comes on and you've never felt it before and you're concerned, it's always best to call 911. As I tell my patients in clinic, you're not going to get charged anything to call 911 and have someone evaluate you, whether you're at home, whether you're out walking the block, whether you're at a restaurant. It's absolutely free service to have an EMS personnel come and evaluate you. They'll check your vital signs. They'll get an EKG. An EKG is very important to be able to tell if you're having a heart attack. So EKG will typically pick up some really significant changes very quickly if your heart's not getting the blood flow that it should. So EMS is going to very quickly know that you need to go to the hospital, and they're going to go ahead and call and have people waiting for you on standby to potentially directly take you to a heart catheterization. Or if they're not 100% sure if this is a heart attack or not, they're going to send you to the emergency room for blood work and repeat EKGs, and that will help them determine if this is a heart attack and it needs to be treated with a heart catheterization. So again, these are sudden symptoms. They don't typically come and go. So a heart attack happens, it doesn't go away. That's a reason you should call 911. And I should say, going back to the difference between men and women, in the patients that I talk to, I do not see a lot of difference between the way they present. I think they're very, very similar. So I wanted to go into more of the specifics of, what exactly happens when you develop a heart attack, because I hear a lot of people have misconceptions about what a heart attack is. I hear a lot of people say, well, I was told I had a 70% blockage 5 years ago, and how will I know if it's 100%? It could cause me a heart attack. So a heart attack does not happen because an artery slowly but surely over time becomes 100% blocked. What happens with a heart attack is if any piece of plaque, and so I'm going to kind of hover over that yellowish looking plaque that I'm referring to, if you have any plaque in the coronary artery, whether it's 10% or 50% or 90%, if a piece of plaque becomes unstable, and that can happen if you're maybe under a lot of stress, maybe your blood pressure is uncontrolled, it can just be bad luck. Piece of that plaque ruptures, and that triggers the body to want to heal that area. And so the body forms a clot, and the clot blocks off the blood supply to the heart. And that's what causes you to have sudden chest pain or pressure, shortness of breath. And that is reason that you would want to get to the hospital so that we could open the clot up with a stent or a bypass surgery. So just a very important thing to know, any plaque can trigger a heart attack. I'm going to play a little video just because I think it helps to see it, in real time.
If you have acute coronary syndrome, blood flow through your coronary arteries is severely reduced or completely blocked. One possible cause of reduced blood flow is atherosclerosis. In this condition, a buildup of a fatty substance called plaque can narrow your coronary arteries. If this plaque ruptures, a blood clot can form and block the artery. A blood clot is the most common cause of coronary artery blockage.
So I think that kind of gives you a picture of what happens in the arteries. So it's that acute blood clot that forms. So to prevent a heart attack, we focus on how to prevent a clot. And so we'll be talking about that in the slides to come. Again, if you think you have symptoms, you should call 911. Okay. All right. If you're having a heart attack, you're taken to the hospital, what's going to happen is you're going to get a heart catheterization. They used to go in through the groin for heart catheterization, but now we've switched and we've started going through the wrist because there's a lot less bleeding and complications. So what they do is they insert a small wire through the wrist, and they're able to guide this wire into the arteries of the heart, so into these arteries. And what we're able to do is inject IV contrast dye into the coronary arteries. And then we're taking pictures using X-ray. So the doctor can see where a blockage is. And that way they know where to pinpoint a stent placement. Or in some cases, if they can't put a stent in, and let's say the artery is too blocked off, or there's multiple arteries that need treatment, they may recommend bypass surgery. Most of the time we do treat with stents these days. So you'll see the stent is underneath number 5 here. So what they do when they find the area that seems to have the acute clot, the acute blockage, they're able to insert this wire into that narrowed clot, and then they inflate a balloon to kind of open up the area. And then on that balloon is a stent. So that stent expands and is put in place. And that stent is there permanently to open up the blood flow. People feel immediate relief of chest pain when the stent goes in. So you are awake during a catheterization. They then deflate the balloon and then remove the wire from your artery. And that stent, again, is there permanently. It does not move. It does not need to be replaced. Now, I also wanted to show a picture of bypass surgery. So again, I mentioned less frequently we have to have people go for a bypass surgery, but wanted to show you what that looked like. So there's 4 different pictures here. The left-hand picture that I'm highlighting now, this is a picture of a single bypass. So the blockage here is being rerouted. What they use with the bypass is they're using an artery or a vein from another part of the body, usually from the leg or from the mammary artery in the chest. And what they do is they remove that vein or artery from another portion of your body, and they more or less attach it to the artery that needs blood flow and is not getting blood flow. And then they attach the other end. In this case, they can either attach it to the aorta or one of the arteries off of the aorta. So an area that has good blood flow. So they're in essence bypassing the blocked artery. So this is a single bypass on the left, double bypass next to it, triple bypass, the third picture, and then the fourth picture is a quadruple bypass. So that's what that looks like. After you've had a heart attack, you are started on a lot of new medications. You are started on aspirin, 81 milligrams. That is a baby aspirin once a day. They send you home with some sort of antiplatelet medication, usually Plavix, Brilinta, or Effient. Those are prescriptions, and that for a year after you've had a heart attack. They also send everyone home with a beta blocker, such as metoprolol. What that does is it basically slows the heart and allows more time for the blood to fill these arteries. So it usually prevents chest pain or angina, reduces strain on the heart. If you're not already under good diabetes management and blood pressure control, they'll put you on medication for that. They will send you a referral to cardiac rehab, which is the picture I've got on the right here. And that's just to kind of regain the strength in your heart and hopefully get you on a healthy exercise regime that you can continue going forward. They'll talk about weight management and a healthy diet. And again, they will usually treat the heart attack with a stent or bypass surgery. Occasionally, if let's say the person is too sick or has some underlying reason they can't have surgery or a blood thinning medicine, sometimes we won't put a stent or a bypass in, but most of the time we do. Now, I wanted to go through the difference between a heart attack and angina. Other people call it angina. You can say it however you want. It means the same thing. But a heart attack, as we talked earlier, is usually sudden onset, can wake you from sleep, can happen any time of day, and it doesn't get better. It continues to occur and usually causes you to call 911 and get evaluated. Angina or angina is when, let's say you've got some cholesterol plaque that has been slowly building for some time and it's starting to impede or interfere with the blood flow. It's going to cause maybe intermittent symptoms, typically with exercise or exertion or stress. For instance, you're watching your favorite sports team and it's not looking so good. You're anxious about the outcome. That could bring on angina or angina. Or if you're in an argument with someone, so you're getting really heated, it's when your heart is beating faster and it's not getting the blood flow that it needs. That's typically when people will get this angina. And angina feels very similar to a heart attack, except it's not typically as severe, doesn't last as long. It goes away with rest or nitroglycerin, or once you've calmed down, once the game is over. And in the hospital, we can tell the difference between these two. With a heart attack, you're going to have elevated troponin level. That's a blood test. With angina, you're not going to have elevated troponin. EKG usually is not going to be abnormal with angina, whereas it will be abnormal with a heart attack. And that's why it's important to get evaluated in the hospital or by EMS if you are having symptoms and they're not going away, because they'll be able to tell if this is a heart attack or if this is angina. Treatment for angina is going to be very similar as treatment for a heart attack, except it's not an urgent, you don't have to have a heart catheterization right away. So this is, it's stable. So we call it stable because it comes and goes. It's not acutely life-threatening. So the treatment for stable angina is going to be regular exercise, eating healthy, weight management, blood pressure control, diabetes control, aspirin. If you're not already on aspirin, they'll recommend it. And then medicines to help increase blood flow to the heart, to help alleviate the symptoms that you're having. So medicines that help with the blood flow would be beta blockers or calcium channel blockers. So that would be metoprolol or diltiazem. We also will often give people a prescription for nitroglycerin to have to put under the tongue if their chest pain doesn't go away quickly with rest. And that typically alleviates the symptoms. Sometimes we'll put people on a long-acting nitroglycerin, which is called isosorbide mononitrate or IMDR. And that's something you take every day, and it opens up the blood vessels to allow more blood flow to get to the heart and typically prevents anginal symptoms. And then there's another medicine sometimes we'll use called ranolazine or Ranexa, and that can be helpful as well to prevent these symptoms. The goal with stable angina, if we can get medicines to open up and promote more blood flow to the heart, your heart will actually have a chance to create collaterals. So collaterals is basically nature's bypass. So if we give your heart blood flow, your heart will actually create new arteries around blocked arteries to provide more blood flow. And so your heart will bypass itself. And it's really fascinating. The body is a remarkable organ. It continues to amaze me with what it can do. Now, if I write here in red, if the symptoms continue despite medicine, then that's when we'll talk about stress testing and a heart catheterization, and that is to improve symptoms. So this is a very important thing I wanted to make sure everybody understands. So if you're having stable angina that comes and goes with stress and activity and exercise, if we can control it with medication, we will not recommend stress testing or heart catheterizations, because what we found is that putting a stent in for stable angina does not prevent heart attacks, and it doesn't make people live longer. So we're not going to want to put you through a potentially invasive procedure that could have complications and would likely send you home with a blood thinner for a year. We're not going to recommend that unless you're still having symptoms and we can't control them. So that's a really big difference from years ago. People used to get stress tests like every 5 years. It's just kind of routine care, or they might get a heart catheterization every 5 years to keep an eye on that 70% blockage that they had. We no longer recommend that. So that's a big change. And so don't be surprised if you come see cardiology and they don't recommend intervening upon the stable angina. So I wanted to show a picture of what collateral vessels look like. So, again, here's the heart. This is what the normal artery would look like. This is what the blockage is looking like. So that cholesterol plaque is starting to interfere with the blood flow. So he's been having symptoms every time he's, out walking the block. So we've given him metoprolol and isosorbide, and that's helped alleviate his symptoms. And his body has now created these new arteries and arterioles, which we call collaterals, to get blood flow to the area of the heart that was not getting blood flow before. So he's good. We see him back in clinic, all is well, and we continue our regular management for coronary artery disease, and he's doing well. Now, if you're having ongoing symptoms, I'm going to check the time, make sure I'm not, okay, we got about 6 minutes. If you do get set up for a heart catheterization, I just wanted to, a stress test. I wanted to go through what that looks like. So there's 2 common types of stress tests. This is an exercise stress test. So if you're able to walk on a treadmill, this is usually what we'll recommend. But you'll be hooked up to an EKG monitor. You'll be hooked up to a blood pressure cuff, and then they're going to get an ultrasound of your heart before and after you exercise. What they're looking for is a discrepancy in the way your heart pumps before and after stress. So they're going to have you on that treadmill, and they're going to increase the incline, increase the speed, and they're going to get you breathing heavy, get your heart pumping. And we're looking to see if there's a discrepancy. And if there's a discrepancy in the way the heart pumps after stress, then that's called a positive stress test, and that would often lead you to a heart catheterization. Now, if you're not able to exercise, we'll typically do what's called a nuclear stress test. That is where we'll do a scan of your heart before and after giving you medication through an IV in your arm that stimulates your heart to pump as though you've just exercised. So your heart starts beating really fast as though you've been on the treadmill, but you don't have to be on a treadmill for this. So this picture shows someone exercising. For this, you do not have to exercise. But what we're looking for, again, is a discrepancy in the blood flow. So if it's abnormal, you'll often end up with a heart catheterization. So again, we only recommend this if you're having symptoms we're not managing well with medicine. So all that to say, how are we going to prevent this from happening? So I know that's what y'all really want to know. So we talked about the risk factors. You know, there's things you can't control, like your age and whether you're a man or a woman, and if you've had menopause, and your family history, but there are things you can control. So blood pressure management is very important. Ideally, the lower the blood pressure, the better. The current guidelines is around 130/80 or less. So I really like to see blood pressures in like the 110s, 120s, over 60s and 70s. But again, the lower the better. And there's no low that's too low unless you're feeling dizzy and lightheaded, because I get that question a lot. You know, what's too low? As long as you're getting blood flow to the brain, the blood pressure is fine. Physical activity, very important. 150 minutes a week of moderate activity, or 75 minutes of vigorous. So moderate activity is anything where you can still converse with somebody. So you're walking the block with a neighbor, you're playing pickleball and, you know, joking around. That would be considered moderate. If you're doing strenuous activity, you're not able to carry on a conversation because you're huffing and puffing so much, you're just focusing on breathing. So that's all you need for heart health. Now, if you do more than that, great, keep doing it. But if you're not doing that, I'd encourage you to work up to that and work with your limitations, because I have a lot of people with back issues or hip or knee issues, so work around those things. You can try Pilates, or you can do things from a chair. There's all sorts of things you can find on YouTube. Type in, exercises for people with bad back, or exercise from chair. Tons of stuff you can find. The other thing to control is cholesterol. So we talked about that. If you have high cholesterol and you're not on cholesterol medicine, you should certainly be having that conversation with your healthcare provider. If you know you have heart disease, you're probably already on cholesterol medicine. If you're smoking, find a way to stop. There are certainly tools out there to try to help you, but most people that are successful quit cold turkey. Diet, a heart healthy diet, the Mediterranean diet is what we recommend. So that's going to be things that you find naturally and that are not made in a lab, or a factory. So it's whole foods. So eating fresh fruit, fresh vegetables, you can certainly cook them, but things that you're, where they came from. They came from the ground. We focus on lean meats. So less red meat, more chicken without the skin, more fish, turkey, pork tenderloin, low-fat dairy, so things like yogurt and skim milk, cottage cheese, things like that. Legumes, so beans of any sorts. That's things like black beans, pinto beans, lentils, whole grains. So that's things like Dave's Killer Bread and quinoa. So making that the majority of your diet. And of course, we don't expect anyone to be perfect, so all in moderation. If you're diabetic, the lower you keep your blood sugars, the better. The goal is an A1C less than 7%. There's a few different types of medicines out there that should have, are shown to have heart benefit, and those would be SGLT2 inhibitors, things like Jardiance and Farxiga, and the GLP-1 agonists, which would be things like Trulicity, Ozempic, Victoza, and then aspirin. And I'm going to talk about that in this next slide as to whether you need that or not. So, aspirin's gone through a lot of back and forth through the years. For a while, everybody was taking it over the age of 50. And then a few years ago, they said, no, not everybody should take it. If you've had a heart attack, if you've had a stent put in, if you've had bypass, if you've had a ischemic stroke, so the type of stroke where there's been a blockage, not a bleeding stroke, or if you've been told that you have coronary artery disease or cerebral vascular disease or carotid. So basically, anytime there's this plaque, this cholesterol buildup in the arteries, you probably should be on a coated low dose aspirin. So that's the 81 milligrams once a day with food, and that helps to protect against ulcers. If you can't take an aspirin, let's say you've got a history of bleeding ulcers in the stomach, or you have a history of significant anemia from blood loss, then your providers may not recommend an aspirin to you. So it's an important conversation to have with your healthcare provider. If you've never had a heart attack or stroke, and you're not having any symptoms whatsoever, and then the data is probably not as clear. So that's a conversation to have with your provider. Most of the time, the answer is no, if you haven't been told to take one. If you are taking one currently and you're not sure if you should continue, don't stop it until you talk with a healthcare provider. So call your primary care provider or your cardiologist and have that conversation. And then last but not least, I thought this was important because they do make this a big deal in the Heart Association websites. Vaccines. If if you're over the age of 65, you should make sure you're up to date on vaccinations. I mean, really all of us should, but the older we are, especially if you have heart disease, you should be getting your yearly flu shot. You should stay up to date with your pneumonia vaccine, your shingles vaccine, the COVID vaccine. And yes, I absolutely believe in vaccination. Some of the cardiac resources I wanted to give you guys, because there's so much information. Cardiosmart.org is a great website by the American College of Cardiology. Heart.org is the American Heart Association. There's tons of information about blood pressure, about diet, about diabetes you can find. I love this cookbook for Mediterranean diet. I actually heard this doctor speak at a conference years and years ago. But he and his sister, who's a dietitian, created this cookbook called Good Food, Great Medicine. And I think it's just a great overview of the Mediterranean diet. It gives you some really great recipes. They really go through the why. Why is this good for me? Why should I have this in my pantry? Why should I follow this diet? So I recommend that. You can get that on Amazon or places like that. And then MyFitnessPal is a great app you can download on your phone. It's free. But it's a great way to keep track of your calories. And if you're needing to lose weight, it's a great way to do that. Or if you're needing to manage your blood sugar, or you're wanting to limit the amount of cholesterol in your diet, it's a great way to do that. And that's my final slide. So I thank you guys for listening, and hopefully this wasn't terribly boring. It's really weird to have a talk by myself in my dining room and not to be able to see people. So I hope that y'all got something from this. I think Deb is going to help get some questions going. So if you've got any, do that. And then I've got my email listed and our phone number. If you feel like you need to see cardiology, that's our phone number if you feel like you need an appointment with us.
And if you want to stop sharing your screen, then we can I'll manage all the questions. Okay. We've already gotten a couple. So I'm nervous about taking statins. What are your thoughts? Are there alternatives?
Yes. Okay. So there's lots of alternatives. I don't know if y'all can see me at this point. Deb, can you see me?
Yeah. If you could stop sharing your screen, we'll be larger.
Okay. I am so bad at Zoom. I'm sorry.
No, it's okay. We don't need you to be a Zoom expert, just a heart expert.
Okay, that's right. Okay, let me close this completely.
And if that doesn't work, we can just do it the way we're doing it.
Okay, I think I'm back in.
There we go.
Okay. Woo. Okay, yeah. So if you cannot tolerate a statin, or I know a lot of people have horror stories, or they've heard terrible things about statins. So if you cannot take them, there are alternatives like ezetimibe, bempedoic acid. Those are pills you could take once a day. There's injectable cholesterol medications on the market now every 2 weeks. So Repatha and Praluent are the trade names on those, but those are really great at lowering cholesterol. And then there's an injection twice a year in the clinic that we can do called inclisiran. So there are alternatives. If you haven't ever tried a statin, we're typically going to have to start there, because insurance, of course, doesn't want you to go for one of these more expensive options if you haven't tried the cheapest. And I should say statins are very safe and very well tolerated. They get a very bad rap, but most people tolerate them fine. It's amazing after a heart attack how many people do fine on a statin.
Well, and
So,
again, it's probably a conversation to have with your healthcare provider.
absolutely. And I have this on a daily basis. So it's important if you're concerned about it or don't want to take it to have that conversation.
Okay. We have another question. What test or screening procedures are recommended? I'm 65 with high blood pressure.
Yeah, good question. So as I mentioned early on, there are not screening guidelines in the United States for coronary artery disease. So it's typically a conversation to have with your primary doctor. If you have risk factors like blood pressure, like cholesterol, like diabetes, it's certainly reasonable to consider a screening exam called a coronary calcium scan. We call it CAC scan for short. We're doing this at Atrium, but it is a non-contrasted CT scan of the coronary arteries. So it gives us kind of a bird's eye view of whether you've got plaque in the arteries. And if you've got plaque in the arteries, that will help us determine, do you need cholesterol medication? Do you need aspirin? Do you need, anything further? So a coronary calcium scan is a great way to screen for it. Or if you've already had a CT scan, so we see a lot of people who maybe are tobacco smokers or they've had a CT scan of their lungs already. It may already comment. You look under the scan and it may say coronary artery calcifications. If you've got a scan that shows coronary artery calcifications, then you have coronary artery disease. And that would be a reason to talk with your provider about aspirin and cholesterol medication.
All right. How often do people need a stress test or heart catheterization?
Yep. So right now, we do not recommend any routine stress test or heart catheterizations. That's even in people that we know have a history of heart disease or bypass or blockages. So it's purely based on symptoms. So every time I see my patients, I'm like, call me if you're having new or worsening chest pain with activity or new or worsening shortness of breath with activity, because those are the most common symptoms that your heart is not getting enough blood flow. It's going to be with exertion, with activity, or like I said, watching the Wake Forest play Duke the other night.
And the Super Bowl.
And the Super Bowl. Yeah, that was a nail biter.
Well, the other comments so far have been wonderful information, great information. Thank you for sharing.
Good.
So I think everyone was grateful. You made it very easy to understand. And the good news is Courtney has already shared her slides with us, so you will be getting a copy of her total slides. And as always, we thank you so much. I had a crazy command hop up. We thank you so much for joining us. And we want to see you back on March 12th for the next Aging Well. And until then, have fun, love yourself, love this weather that we're having, and take care. And we all have to age well.